First of all, I would like to thank the Express Healthcare and all of you here who have an amazing audience today. I think it's our privilege to be a part of this panel today. As we all know, India is going through transformation, whether it's cricket or politics. So of course, healthcare is also going through massive transformation itself. And hence, I think the most important thing is, where do we see change management, where do we see transformational leadership? So I would, on behalf of all the audience and Express Group, would like to welcome all the panelists here. I think it's indeed a privilege to have you on the panel. I'm sure you all are achievers of transformations and have brushed through change management at some point or the other. So with this, I think we can just have a quick round, and we can just a small question for all of us here as to why do you think that transformation management is important in healthcare? So we can start from you, sir.
Sure, thank you. I think a lot of the answers have come from the preceding several speakers, and I'll just reiterate why we need to transform today in healthcare. As has been alluded, in India and so also globally, there is healthcare at an inflection point. In India, this is moving into, like it or not, low cost, low margin, high volume kind of healthcare delivery, which addresses a much larger volume of people compared to earlier. The second and most important is the fact that technology has found its way into every aspect of healthcare. Adoption of technology speedily, effectively, and at a cost that is affordable in the context of total healthcare is the second and most important factor. The third is the way in which the dynamics is changing from what it used to be and moving very strongly towards patient-centric care. Patients now are a different breed of people. They expect much more in terms of information, knowledge, and I think this demands us to move into very strong evidence-based practice and adequate documentation and communication, and requires transformation of the way we practice. And those are my points.
Thank you. Thank you so much.
No, the level of healthcare is that level in that place. So unless we equate all the healthcare into one basket and talk about accountability and outcome, we are not going to improve as a country. The good thing is we have started discussing and we are one step right at the right time now. Thank you.
Great. I will start from where my friend Dr. Kishore from Cloud9, he has put me in cloud space stating that what if that happened in a private hospital, how would you treat it? Exactly. Hospitals can be different. It can be a government hospital or a private hospital, but the patient's life remains the same. He is just the same human. And why is that we have a big disparity between government and a private sector? No one asked this question. Unfortunate thing is there are a lot of unreasonable questions being asked against private hospitals. Now, with the previous speakers, as well as Dr. Ajesh, as well as everyone else, we all speak about cost. We all speak about why there is low reimbursement from Ayushman Bharat or any government scheme like the CM insurance scheme in Tamil Nadu or any state-run insurance schemes. If you actually look into it, government are bringing these schemes to attract vote bankers. They are telling people that look, I'm taking care of your health, vote for me. That's the logic behind them. But do they pay enough to the private hospitals to at least cover the cost? Now I'm not talking about paying enough so private hospitals make money out of it. To at least cover the cost of doing the treatment. Has there been a single study in India by the government to check what is the cost of providing healthcare. Like for example, if you have to do a CABG in a hospital, or if you have to do a hip replacement in a hospital, what is the cost incurred by the hospital to do that surgery? AHPI, which is an association of healthcare providers of India, which is an association of private hospitals, in association with IIM Bangalore and cost accountants in Karnataka, they did a study. This is a study done by the private hospital association, not by the government of Karnataka. The government of Karnataka obviously supported it, and they came out with a report which stated what is the cost incurred by hospitals to do procedures, and the reimbursement rate which was given by the state government for those procedures was less than 20% of the cost incurred by the hospitals. It is shocking. It is less than 20%, and how do you expect hospitals to do it? And to survive, let us forget about making profit, to survive. There is reasons why a lot of hospitals in Kerala have been closed. It is because not because they didn't make money, it is because they were making huge losses. And that's because of these developments happening in this country. And unless as professionals we join together and educate people, educate bureaucrats and tell them, look sir, we are ready to help people. We are ready. In fact, Ayushman Bharat is a great initiative by the Prime Minister of India, because the first time the country has got a Prime Minister who is talking about healthcare for all, which is great. But is it executable? Is it practically possible? So these things have to be addressed. And in leadership, I think as a role as a doctor or as an entrepreneur or as a founder of an organization, it is time we all step out of our hospital boundaries and look into other issues and solve these issues, because things that happen outside will influence what is happening inside the hospital. So in Tamil Nadu, we went to the courts, we said, look, the CM insurance scheme rates are too low, you have to revise it. And the court favorably gave an order. They said costing should be done before pricing, which means the cost incurred for a hospital for a particular procedure has to be ascertained, and only based on that a pricing has to be done. But this order gives a benchmark of what has to be done, but it doesn't say do this, do that. So we again went to the government and we spoke to them, and then we went back to the court, and the matter is pending before the Honorable High Court. We are positively expecting that something good will happen, because only if reimbursement rates, whether it is Ayushman Bharat, whether it is any state-run insurance scheme or whether any insurance scheme, if the reimbursement rate is equal, practically it should be more than the cost that is incurred for a hospital to do that procedure. That will be a win-win situation for both the hospitals and the insurance provider and the government. So to make that happen, I think it is a collective responsibility of all of us, and we should all take the leadership role. It is not the role of one person or one community or one association. It is the role for all of us, because healthcare for all can happen only if all of us join together. Thank you. This is my opinion.
So coming back to the transformation. Transformation is not a choice. I mean, we assume transformation, we're all idealistic about it, as if it is a choice. A gun has been put to our head, and we might as well transform. Nobody's done transformation willingly in private healthcare, at least. We've just copied each other. We talk about costing. None of us know head or tail of it. Most of us, at least. I can't say everybody on this dais, but most of us don't know head or tail of it. And we've seen 5 costing exercises, and the pricing has been from whatever to whatever. And in fact, I read Michael Porter. He gave a lecture to us one of these days, and he has a book, Activity-Based Costing in Healthcare. I never understood the first 5 pages, I left the book. It's all theory. Costing in healthcare is a humongously challenging task. We can estimate costs, and that is the best we can hope for. So transformation is not a choice anymore. All of us in private healthcare just wake up and figure out, this is the environment, how do we deal with it? Ayushman, this scheme, that scheme, we can cry all we like, but we'll have to figure a way of surviving in this. Unless we want to do something else. If I want to play golf in America, that's okay. I mean, We all have our choices. But if I'm going to run healthcare, I'm going to be in healthcare, might as well figure out what is the right path. The costing is going to be lower than CGHS, ECHS, sir, we were sharing on that CII healthcare committee averaged 45% lower. How do we survive in that environment? That is a big challenge. Technology, it's an amazing challenge. My friends from Fuji are sitting here, they like to sell me the expensive digital X-ray. Wonderful. Sir, kitna clear nazar aata hai. Very clear here, it's very good. It looks nice also. Sir, only 60 lakhs. I've been used to doing X-ray on 6 lakhs, now only 60 lakhs. The cost is coming down, the prices are coming down. Technology, what does it do for me? So digital X-ray is fantastic. It catches so many things that we couldn't catch earlier. But there is a price to pay for it. Technology is not free. Who's willing to pay the price? How do we do this costing? I haven't figured this out. Honestly speaking, I haven't figured this out. But this is the challenge we face, both in terms of transformation and technology. How do we face the challenge? I think we look for answers from our seniors always, and I hope the audience can give us some answers.
So good. I think we have all got various diverse answers. I think we moved from transformation required in healthcare from organization to a country level. So it's quite interesting. But I think the most important thing is that, well, looking at this watch in front of me, I have to be a very strong and strict timekeeper. So we'll have to watch our time so that all of us get time to express our views. So I think the next thing I would like to check and ask all of you to share here is that there is one thing transforming India as healthcare leaders, and there is another thing to bring out that transformation in our organizations as leaders. So if at all, let's touch upon bringing the transformation. When I look at you, I'll only talk of transformation of organization. As healthcare leaders, I think we have all gone through a round of managing change, transforming organizations. So first of all, as change leaders, I want to ask you to share with all of us here that do you think that to bring a culture of transformation in an organization, is it pertinent to groom the leadership in the pipeline of the organization or to bring a change agent from outside? Maybe from you, sir.
I think it is necessary that leadership guides this. And that means that
So we are the leaders.
We are the leaders.
Yeah.
And we have to institute specific actions within the organization in order that this changes. As corporate healthcare, I think we have dreamt that big is best, that more is better. And that percolates through the organization, whether we like it or not. And that has to change. Number two, I think there has to be a definite relook at costs. The cost at which Indian healthcare is delivered is indeed very low. But it is staring at our face that we need to go lower. I understand, appreciate and endorse what Ajay said. But the truth of the matter is we'll have to go lower. Which means we'll have to look at costs. And this includes the manpower cost, the infrastructure cost, and so on and so forth. I think introspection and addressing all this will reach us there. And I can tell you, yes, costing of procedures is difficult, but not impossible. And however strenuous, for your respective organizations, costing is an exercise that is an absolute must. Otherwise, you won't know how and where you have to draw the line to say, I won't go below this.
I think that was a very, very interesting and very pertinent question at this point of time. I think as organizations and as leaders in healthcare, when we try to stay the situation which is in front of us, and as Dharminder said, that this is an imperative, this is not something which is optional. As an industry, we need to change and we need to create those next generation leaders who can take this transformation ahead. And if we have to do that, I feel that the traditional approach of people who have been used to a certain cost structure cannot bring about that change. The mindset has to change. We all have seen in our experiences that when you put a person who has been running a hospital for some period of time, you ask them to run a clinic. So they say that, okay, I will run a clinic, I need one in charge of HR, one in charge of admin, and one in charge of this, one in charge of that. And they would build a cost structure which is just not sustainable by the clinic. So the fact is, what I'm trying to underline over here is that if we have to get new thoughts and new ideas, we will have to find new ways to ignite the minds of the next generation and how we prepare those leaders. Now, I don't really have any ready-made answers as to how we could do that, but definitely one of the ways I feel is that people who have medical background should try to learn the economics of healthcare as well. And I think that would help to change the industry.
Right. Very well said. Yes, sir. What are your views on this?
Yeah, I think I totally agree. Transformation begins with the leadership, and from the leadership, you have to have a cost of saving the Just to give you an example, see, when I was working abroad for 20 years, I hardly saw any deaths in the maternity. And that is one of the inspirations why we started Cloud9. And when we started Cloud9, everybody said, no, it's difficult to do it in India and maternal mortality is high. So now when we proved that it's easily achievable in one center, they said, oh, that's because you are always there. Now we have got 20 centers across India and we have done 60,000 deliveries so far. And we have achieved 0% maternal mortality. We have not lost a single mother. And survival of babies, we have got 99.3%. We achieved that through leadership, protocols, strict adherence, and change by bringing the cultural change through the organization. So if we can achieve in one organization, there is no doubt you can achieve everywhere. But that does come at a cost. So if you have to provide that sort of a care, you need 24/7 acute care, which involves obstetricians, pediatricians, and anesthesiologists. Now, we are in a country, most of the cost is based on fee for service. That means you can't be having the obstetrician, pediatrician, anesthesiologist sitting there for emergencies and you don't compensate them. You say, look, you do charity. I mean, how much charity? Whom they are going to feed them? So the infrastructure has to come into picture, personnel has to be there. Along with that, you have to have a nurse, you have to have a theatre, you have to have so many things. So the cost of care has to take into account all those things. When you provide all those things, definitely Ayushman Bharat cannot provide that. So you have, this is just the beginning of the discussions, but if you want to achieve what you want to achieve based on the outcomes and accountability, then the cost of healthcare is going to increase because we are based on fee for health service.
I think it looks more like a session on cost and optimization of cost. So that's also a very important part and we deal with this. So as leaders, I think we have more than cost in an organization. So maybe I'll request the two of you to touch upon anything except costs.
Just as all our friends have said, when the question was put for this discussion, it was put as where do you source the leaders from? You source it outside your hospital or within your hospital? So coming back to that question, I personally think there are great leaders within the organization who know how an organization behaves, what the culture of the organization is. So it is very hard, it is not impossible, but it is kind of very hard to get someone else, put them in and train them and see them and hand over the bigger responsibility to them. It is much more better if an organization can identify potential leaders within the organization uneducate them, untrain them, and bring them up so that it gives an opportunity for growth for the existing staff, existing team members, as well as it is much easier for the transition to happen. That's my personal view.
It's already getting interesting. So we have one view that we should have get change agents, and the other view is we need to groom the leaders within the system. So what's your view on this?
So I agree with both of them.
Fantastic. Well, I'm the moderator though.
So in fact, I'll relate a simple, I was sharing with one of my colleagues, and he was sharing how they recruited doctors, and he's been doing it for 10 years. The only answer I had for him is, कि भैया भूल जाओ what you've been doing for 10 years.
Yes.
Just forget it, if you can. It's not easy. Whatever has happened in Indian healthcare in the last 10 years, we'll have to wipe the slate clean. Look afresh. The challenge I find myself in is I'm also kind of predetermined by history of last 10 years. It's not going to help me. It's not helping me. We have to project 10 years forward and then figure out what we need to do today. Whereas everybody's playbook is, sir, pehle aise hota tha, this is how it used to be, what can we do? So let's all tear up the last 10 years of playbook and create a new playbook, looking forward 10 years, what is the possibility, where we are headed, and what we need to do to fulfill that. And I think that is what can happen.
I think you put it up in the best possible manner. I think it's absolutely right. I personally believe that it needs both. You need to have people with either the new rules, or you need to have somebody bring the new rules in. So that's interesting. And now taking upon the point on the fact that driving transformation is driving culture changes. So let's touch upon quickly as to how we can drive, each one of us can drive a culture change, or things can culture change be driven in an organization and through an organization. If it can be done in one organization, then maybe another organization, and we are talking about healthcare here, and then on a wider space at the country level or state level. So we'll start from you.
Culture change, I think it's very hard. It's really hard. I mean, we all...
The hardest thing.
The hardest thing. But any change happens with acceptance. You have to accept the reality. Most of our conversations are, government is doing that, they are doing that, this is happening, da 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 da. We haven't accepted reality. So change will only come if you accept reality and acknowledge reality. Acknowledge that there seems to have something gone wrong in last 10 years. Let's look at the causes. Not everything is our fault though. There's been circumstantial changes as well. Like acceptance. So please accept. Things have gone wrong. Please accept, both at organizational level, individual level, both as clinician, managers, everyone. Change will only come if we truly accept. Most of us, all change management, read about it, don't believe it, and want you to believe it. And I think that starts from home, nothing else.
Absolutely. Thank you.
Yes, but after we accept it, what do? We need to act based on what has happened. So that's what I said when I previously spoke. I said, when this cost issue came, sorry to go back to the cost issue, we went to the high courts and filed a case.
Now
so we accepted the cost.
The cost topic for the other.
No, I'm not going into the cost. I'm saying how we reacted. We accepted that the reimbursement rate is less, but we didn't just accept and leave it. We went to the high courts, we spoke to the government, and we are trying to make the change. So accepting it and then moving forward positively, making steps for the change is important. And to address your specific question of how you bring a change within the organization, I think role play is one of the best method for any organization to bring change within the organization. So what we personally do is, when we have any complaints from the patient or any error happening in the hospital, that is documented, and staff they play a role play. So they enact what has happened. There will be 10 staff members. They do it. It's like fun to watch it. they basically tell the other staff how it happened and how the patient suffered and how it can be rectified. Because most of the time, nobody does something intentionally. It is only an error on a system, on a process, and not on the person. So when the blame is put on the system, people come forward and correct it. When you put it on a person, they hide and they will never be ready for change. So I think that's the best way to put it in any hospital.
Super. Yes, sir.
Yeah, the change has to come from within and it has to be non-incriminating way. See, once you start incriminating people saying that you've done it, as my colleague said, nobody does it intentionally. If you look at the airline industry, 20 years ago there used to be a lot of accidents and simulation training virtually made airline so safe. Nowadays we hardly have any accidents at all unless it's 737 MAX, and even that could have been prevented with the simulation training apparently. So in medicine, there is a lot of focus and emphasis nowadays on simulation training, and we do follow simulation. And one of the reasons we have achieved very good outcomes in Cloud9 is because if anything doesn't go according to plan, or if anything not looking normal, we have a debriefing meeting without finger pointing. We discuss what could have been done better, what can be done better in the future if it happens again. And these sort of things are very, very important. In fact, medical errors account for quite a number of deaths even in the US today. But the only reason they are correcting them is accountability, and it is looking into what could have been done better. In fact, there is a book written by Atul Gawande, I'm sure all of you know. You have to read that. I mean, in fact, recently he wrote a new article called Letting Go. In fact, if you read that also, that small article, Letting Go in New York Times, you will see that there are lots of errors which happen in life at various stages. So unless we start accepting that there is going to be unintentional faults and start changing ourselves, change is very difficult. And change has to come from the leadership.
Super. Yes.
I think change of culture is a very loosely and very widely used term. It's very fashionable to say that we have to change the culture of an organization. I was recently given an assignment to say that you have to change culture of an organization. And no one knows it better than I do as to how difficult that is. But I think what Dharminder said is the key.
Yes.
The first step in making a change is to realize that a change needs to be made. Unless that acceptance comes, nothing changes. And the transformational leadership, the way it has been defined, and the 4 core characteristics of what a transformational leader is, I think that's where the answer lies. You first need to inspire that confidence. Then you need to walk on that path, on that road, for people to see and emulate what needs to be done. And then, as once famously Ross Perot had said, and he is considered to be one of the biggest practitioners of transformational leadership, is that you let people go and let them just make mistakes. Don't punish a person for making a mistake, but punish a person if he doesn't do what he's supposed to do. So their company slogan was, "Go do it." So I think that's where the answers lie. The transformation starts with recognition that the change needs to happen. And then the leadership has to drive it in terms of how they live it up and how they communicate it effectively to the teams.
Thank you. Yes, sir.
Okay, it's always difficult to go last. Most of what you want to say is already said.
I wanted to be fair.
No, you were more than fair. You asked me to go first twice, so. But I would say this. Firstly, I think you need to have conviction within yourself about culture change. I can tell you a lot of what the organization ultimately is because they look up to the leader and say, this is the way we should be. And the conviction has to be there. The second point is to agree on the culture change. Yes, the word culture is a large word, and there may be different aspects to it, but we need to identify what part of the culture needs to change. Once this is identified, it has to be a democratic drive that moves this at all levels. I mean, all of us understand that healthcare industry is so diverse. You have doctors, nurses, non-clinical people, and the culture change has to percolate through all these. And we know how easy or difficult it is to change the culture of certain people. I'm a person who's had 4 decades of clinical expertise, but I am now an administrator. And if I look back, I know how difficult I was as a surgeon when I was asked to change. So this is something that has to be driven after everybody agrees and drives it together as an industry. And I think due pats on the shoulder for effecting change is an absolute must. When one realizes that change has been made by people, appreciate it.
Very well said. Great point. So when all the transformation leaders go through the change themselves, inculcate that they have to change, inspire people to change, they face something which is called resistance to change. So in your views, whether you have read it or whether you have experienced it, how a great transformational leader can go above that and tackle the resistance to change?
So I think resistance to change is but natural. I think we must all kind of hope it is there and expect it is there. Because none of us like to change. If I change the exit from there to this door, we'll all get confused and start complaining. Yeah, door change kar diya. This is but natural. Now, how do you mitigate and how do you inspire people to change? I think you have to go a step back. You have to re-communicate your values to the people. Kyun kar rahe ho? Why are you making this change? Most of the time, we are unable to communicate the reason for change. And the reason has to be pragmatic, but it has to have values behind it. So communication of values, and it doesn't have to be a mass level communication. It will percolate from your own leadership. I honestly don't meet so many people, and I'm a bit of a recluse. But I hope when I'm talking to my individual direct reportees, I'm communicating more values. What am I trying to achieve? What are we trying to achieve? Do we have shared goals? That is very, very important. Let's change because the environment has changed and there is no value behind it, doesn't work. People don't buy your bullshit. Let me put it this way. They may put their head down and say, yes sir, of course sir. Absolutely sir. You read at Harvard, I read at McKinsey, fantastic sir. But we will not implement change until unless we have shared values. Communication of shared values will, I think, break down some resistance. Otherwise, the walls will keep high.
Absolutely. Anything from you where you feel you
Yes,
can overcome resistance?
As doctor said, I'd like to point what he enumerated. When you pat someone on the back, when they actually show results, and when it becomes a common goal instead of the chairman's goal, the resistance to change will be very less. Because now it's the problem of the team, and the team has to come together and they have to solve these issues. It should never be the problem for the chairman, it should be the problem for the team. And chairman is just a part of the team. And if that works, and if an organization works that way, there will be probably least resistance for change from people who don't fall into the team. So it's your ability to have the team and to encourage them that would show the result.
Super. Yes, sir.
Change is not painful, but resistance to change is painful.
Very painful.
And resistance to change is, resistance to change is everywhere. In fact, we introduced electronic health record from the day one, and even today we have about 20% of the doctors who are not used to using electronic health records. And I thought ours is the peculiar situation, but I went to American Academy of Pediatric Conference 5 years ago and I saw banners everywhere. We are pediatricians, we are not typists. So there was resistance from pediatricians even in the US to use electronic health records. It has taken 7 years in the US for all pediatricians to use electronic health records. And in spite of explaining the benefit of using electronic health records, data creation, analytical things, various things, in our institution, it took nearly 5 years for all the doctors to start using electronic health.
You are very lucky.
So it is time consuming, but persistence, perseverance, patience is what all required.
Great. Yes. Look.
I think it's all has been said. I think the key lies in communicating and then having those shared values. I think that's the only way it works. Otherwise, resistance is going to be there because human beings are basically designed to be resistant.
I've got 2 examples of successful change of culture that we initiated and did as illustrations of 2 strong tools. Firstly, we changed the formulary, and I was told this will never happen because of the resistance from doctors. We had our clinical pharmacologists go and speak to every doctor about the quality of the drugs that were currently being in the formulary, changed in the formulary, and gentle persuasion to change. This was not easy, but persistence. We now have 98% acceptance to the changed formulary. There are just 2 doctors, and we know that they will change. But so the first is communication for the reason, gentle persuasion, persistence, because punitive and more autocratic approaches increases resistance. This is the first example I'd like to quote. The second is time management. Meetings in the organization always overran time and started 5 minutes late. Not very late, but 5 minutes late. Here, lead by example. I ensured that I was always 5 minutes early, started dot on time, and finished dot on time. And I explained and expressed the value of this by showing the efficiencies that happen as a consequence of one meeting following the other exactly on time. My colleagues follow it today. I don't have to tell them. In fact, they look at the watch if I'm a minute late.
Very well said, sir. So I think we've got great answers from all of us. Now, I'll just summarize whatever we got, and it will make us to think that if it can work to change an organization, why not most of the change which healthcare today is experiencing, why can't the country also follow the same things what we all have just now said? So it's basically we have to lead by example when we are doing a change. We have to align the change. We have to get the change agents or convert the existing people into change agents. We have to reward people and we have to manage resistance by communicating the shared values, common goal of a team, perseverance, patience, and time management. So I think with this, if the government also thinks like this, I think Ayushman Bharat would not have resistance. I personally also feel on behalf of the entire panel, I think as change leaders, we all feel that because this is what we do daily in our organizations, and if this country is the biggest organization, then if all these steps are followed, I think we will, on a healthcare basis, we will definitely be in a situation where we will be able to not only, now I am saying, reduce our cost, but at the same time get the best outcomes which the world inspires us, or which we will inspire the world now from. So with this, I think I conclude this, unless anybody would like to add a few at the end. I think we have still some time left for our discussion to end.
I think it's good that we have started the discussions, discussion is the first step to change. And healthcare has always been not on the top agenda in the past governments. Now at least this government has started talking and implementing changes. The reason I'm saying this is I'm not Modi fan or anything like that. See, for example, immunization. We have got a lot of vaccinations against deadly diseases. The best example is polio. Polio virtually eradicated the disease. Smallpox virtually eradicated the disease. And we have so many vaccines available. This government implemented 2 major vaccines in the last term, and that has started showing significant infant mortality reduction in various states like Uttar Pradesh, Rajasthan, Madhya Pradesh, everywhere. So there are lots of preventive health, lot of public health measures to be taken. Currently we are talking only about acute health care. Preventive and public health care virtually does not exist in India at all. So I think it's a good start. We are starting talking about it. I think the focus has to be preventive and public health. So the stress on acute health care will be much reduced.
Very well said, and I think, as I said, we are going through transformation leadership across from the country to the in every sphere. So we are all experiencing it, and the government is using all these what we just now mentioned as an organization. So good. So I think you had a great session. I could see we have been able to keep most of you awake in this afternoon when everybody is now looking forward for the tea break. So thank you very much for being a great audience, and I would like to thank all the panelists here for being excellent, and we in short we did well on time management. So exactly 0. So thank you so much. Thank you.
Thank you very much, Ashutosh, for that fantastic moderation.